Hello, today we are discussing dental diseases. Dental diseases are categorized into two. One is dental caries. Dental caries. Caries. Dental caries. Two is periodontal diseases. Periodontal disease. Periodontal. The word period ONTAL, periodontal disease, categorized into two, dental caries and periodontal. Starting with the first one, dental caries. The other name is just tooth decay. Dental caries is tooth decay, which is characterized by those holes in the teeth. So dental caries is caused by plaque. Plaque. Plaque is mixture of foods such as starch, those sugars, microorganisms together. It forms that plaque. Then microorganisms will break down this plaque. As it breaks down, it releases acids. Then the acids will react with the enamel. The enamel is the outer, the one you see here. This what is the enamel, the hard surface of a tooth. It is made of calcium phosphate and calcium carbonate. So the acids will break it down, and that's how those mashimo, the holes, will be formed. At first, you may not feel any pain. After the enamel, we have the dentine, and then from the dentine, you get to the pulp cavity. The pulp cavity, there are nerves. By the time you feel the pain is when the cavity is deep. It has accessed the pulp cavity. So at first, you may not feel any pain at the level of the enamel and dentine until it gets into the pulp cavity. Feel the pain, that is a toothache. It is common in young children, they love sugary stuff. How can we control? One, avoid sugary foods. Secondly, eat hard foods, carrots, sugarcane, exercise the teeth. The process it removes the plaque. Regularly clean the teeth. That is obvious. If the cavities can be filled, filling process can be done. And if it has gotten to the pulp cavity so deep, a dentist can perform a procedure called root canal. And in serious cases, the whole tooth can be extracted. Just the whole tooth can be removed. The second category, the first one was dental caries or tooth decay. The second one is periodontal disease. It is simply a disease of the gums. It affects the gums. It is not so much of the tooth. Dental caries worse, but this one affects the gums. So it is generally known as the disease of the gums. It makes the gums to be loose and no longer hold the tooth well. There under periodontal, there are two diseases there. You have one, gingivitis or gingivitis, whichever you like. Gingivitis, as Gingivitis, all of them. Gingivitis or gingivitis. I love it called. I love it when I mention gingivitis. That's how I teach my students. Gingivitis is characterized by reddening of the gums. The gums become red. You might have seen that in some people, reddening of the gums, bleeding of the gums, and presence of pus in the gums. That is gingivitis. The other one is pyorrhea. Pyorrhea. P-Y-O. The rest of the letters exactly the same as that of diarrhea. You know how to write diarrhea? Yes, diarrhea. So this one is when you write diarrhea, you write D-I-A-N. Double R-H-O-E-A. This one is pyorrhea. P-Y-O. Pyorrhea. Pyorrhea. So pyorrhea is also affecting the gums. This one is characterized by loose teeth. The teeth are shaking in the mouth. The gums are no longer holding it tight. So that is pyorrhea. Loose teeth. It normally affects old people. Many times when you talking to old people, sometimes you realize that some of their teeth could be shaking. It is because the fibers holding the tooth to the gums are affected. So general periodontal diseases, it is due to bacteria. The bacteria affects the gums. There are also fibers holding the tooth. So when such fibers have been affected, then it no longer holds the teeth, and then the teeth become loose. Generally, the periodontal disease of the teeth, how can it be controlled? Balanced diet, foods rich in vitamin A and C. Dental hygiene, again, clean the teeth. Regularly visit the dentist so that it is checked. So that is all about dental diseases. Just categorize them into two main groups, that is dental caries or tooth decay and periodontal diseases, of which there are two under periodontal. Gingivitis, which is characterized by reddening of the gums, presence of pus and bleeding. And secondly is pyorrhea, which is characterized by loose teeth. Thank you for your time. Bye. My name is Hilary, aka Prof. So Prof. Hilary. That's how you can even find in the same in YouTube and all those platforms. Thank you and goodbye. See you again.